Hi, yeah, I'm here to pick up a prescription.
Okay, may I ask your name, please?
Seedorf, Larry Seedorf.
Are you picking up for yourself?
Yeah.
I am your pharmacist, Megan.
Hi there.
It's nice to meet you.
Nice to meet you.
I did notice that this is the first time you're going to be taking this medication.
Yeah.
So if you have a few moments, would you mind sitting down? I just want to go over the important things with you, answer any questions you may have. I just want to make sure you're taking it the best way so that you're not, taking it improperly, getting the best benefit.
Yeah, sure.
Great. Please have a seat. Thank you. Okay, just maintenance-y things first. Are you still at 213-464-3499?
Yeah.
Okay, perfect. Still 5 North Pinnacle?
Yeah, I'm Pinnacle there.
All right. So your profile here indicates that you have an allergy to statins. Is that accurate?
Yeah, her sensitivity, yeah.
Okay. And I see that you're currently taking simvastatin. Have you had difficulty?
Yeah, I stopped taking it. I
Okay.
had really bad pain in my legs. So.
I'm sorry.
Yeah.
Okay, so you did discontinue it entirely.
Yeah.
Perfect.
Yeah.
Do you take any over-the-counters or herbal supplements that I should be aware of?
Like a low-dose aspirin.
A low-dose aspirin just for your cardio, protecting your heart?
Yeah, my doc says to take it.
Perfect. Okay. And what did Dr. Slade tell you that the gemfibrozole is for?
Lower cholesterol, something about triglycerides.
Perfect. That's right. It's just to decrease the bad fats circulating around in your blood. We want to protect you from any kind of heart problems or any future problems that you may encounter. We want to make sure you're safe, so you can see why it's so important to take it.
Yeah.
Dr. Slade has actually asked that you're going to take 2 tablets by mouth twice daily. What I'm going to tell you is I would like you to take 2 30 minutes before breakfast and then 2 30 minutes before dinner with a little bit of food or milk because it can cause some stomach upset and that may help.
I mean, it might be a little hard for me just because I do landscaping and so my schedule can be crazy. Yeah, so I mean, it's going to be hard for me to keep up with that sometimes.
We have strategies that a lot of patients have found helpful, maybe setting a timer on your cell phone, things of that nature, leaving notes if you have a friend who can help remind you. I know it's very difficult, especially if you're eating on the go, but if you take it properly, it really may help, and that will protect you in the future.
Right.
He's actually given you 120 here.
Okay.
Because you're taking 4 a day, that's 30-day supply. So I'm going to see you back here in just about a month.
Okay.
It has 3 refills left attached, so if he keeps you on this dose, I'm going to see you every month thereafter and we can catch up. But I want you to call me if you have any questions or concerns in the meantime.
Okay.
Okay? If you miss a dose, and like you said, sometimes it can be difficult to remember when you're on the go all the time.
Yeah.
Just take it if you remember right around the time you're supposed to take it. But if not, and you've already passed that meal, take your next dose as scheduled. Don't double up.
Okay.
And just store it in a dry, room temperature area. Not like a medicine cabinet. They're actually really bad. Moisture can be, can negatively affect the medication. I've given you a safety cap. Are you comfortable with that?
Yeah,
it's just a push down and turn. Great. Out of the reach of children.
Okay.
All right. May I just ask you to repeat back to me how you're going to take it?
Take it twice daily before I eat. Yeah.
Perfect. So twice daily, 30 minutes before the meal, 2 tablets with a little milk, food if you're having stomach upset.
Okay.
And if you miss a dose, just continue as normal.
Okay.
Did Dr. Slade go over any of the side effects you might expect to encounter?
No, not. I mean, he said that hopefully this would help with the pain.
Right.
I mean, with landscaping, it made it so that I couldn't work. Yeah, exactly. My legs hurt so bad. So I mean, I'm just hoping that I don't have those side effects now with this.
Okay, sure. So stopping the simvastatin should help alleviate that pain. This medication also runs the risk, usually when used with the statin, a little bit of a risk of the muscle pain or weakness. But if you feel that again, I want you to call me.
Okay.
Just something I want you to be aware of as a possibility so that you're aware to look for it. Also, most commonly, a little stomach upset, which is why I told you to take it with a little milk or food if you can.
Right.
Nausea, vomiting, diarrhea. If it persists or it's extreme, call me then as well.
Okay.
Just so that we can make sure that everything's going well for you and it's working out.
Okay.
And I did notice you're still on both the lisinopril and hydrochlorothiazide for your high blood pressure.
Yeah.
And you're okay with taking them daily.
Yeah.
All right, good. So yeah, if you can continue on that as normal, your aspirin as your doctor has prescribed.
All right.
Are there any questions or concerns of yours that I've not yet addressed?
No, not really. I mean, it's just frustrating to feel fine and then take medicine and not feel fine.
I'm so sorry.
All,
yeah, it's not the kind of thing you're going to feel working. You can't feel fat in your blood, but we will monitor you very closely, as will Dr. Slade, and hopefully, within the next few weeks, we can bring those numbers down and stay on top of it as closely as possible, just so that you feel better.
Yeah.
Like I said, call me for muscle pain. If you have any real stomach issues, let me know, and I'll check in with you in a month and thereafter.
All right.
It's been so nice to meet you.
Great. Yeah, it was nice meeting you too.
Have a nice day.
You too.